In your health headlines, it may be a good reason to forget that old adage, cleanliness is next to godliness. It turns out some bacteria may actually be good for you. And while countless lives have been saved by battling infectious diseases with better hygiene, it's also led to an increase in other disorders. Dr. Mitchel Goldman from UCSD, Dr. G, is here as he is every Tuesday to talk about these findings. Thanks for being here.
It's great to be here, Kathleen.
First, explain the difference between this good bacteria and bad bacteria.
Well, you know, the human body contains 10 times more non-human cells than human cells. So basically, we are contained with trillions of types of bacteria. And in our digestive system, there's at least 1,000 different kinds of bacteria. Now, everyone usually has about a few hundred different kinds, and it turns out that the bacteria that lives in us is very important to our immune system and can also affect many different other types of our health-related diseases.
And a trend that you're seeing with all these medical advances like antibiotics and vaccines and even the constant use of hand sanitizers is that some of these chronic non-infectious diseases are actually on the rise now, right?
It is. Most of the diseases, from diabetes to various immunologic diseases to allergies and asthma and even obesity, as we know, is sort of growing. It's doubling every 10 years. And the reason for that is that we are cleaner than normal. And so we have less bacteria in our bodies. We are not taking care of the bacteria in our bodies because of our Western diet, which is typically low in fiber. And so when we don't have this healthy bacteria that we were supposed to have, that's when diseases occur.
Is there a long-term health impact?
There is. And the biggest long-term health impact is cancer. There are new studies that have found that gut bacteria actually protect women from having excessive estrogen for breast cancer. And so by eating more fiber, by exercising more, that'll improve the bacteria, the healthy bacteria that we have, and prevent the development of breast cancer.
In fact, we have a list we want to show our viewers so they can check them off on how to fight the bacteria that you need and keep the good bacteria where it belongs. These gut microbes that you talk about specifically, we hear a lot of things about eating certain foods like Activia and things like that, the probiotics. Tell us how that works and how much is too much.
Well, I don't really know how much is too much, but the idea is we need to vary our diet. We need to eat more fiber, chewy vegetables, and then we can't be so clean. Now, this is really important for babies. You know, it's important for children to actually play outdoors and get dirty. And nowadays, it's like, shoot, you almost want your kids to be sterilized. But if kids are playing outside, they're shaking hands, they're touching a lot of things, they get more bacteria into their bodies. And the younger you are, the bacteria will actually stimulate your immune system, so your immune system becomes better. And that's probably one of the major reasons why we have such an epidemic in so many of those chronic Western diseases like obesity and diabetes and heart disease and cancer. It's because we're not feeding our own bacteria.
All right, let's give parents a green light to lighten up and let the kids get dirty. It's all okay.
And when the pacifier falls on the floor, put it right back in their mouth.
That 5-second rule stands. All right, Dr. G, thanks so much.
Good to be here.